The Biomedical Problems Program, or the BMP, is the first 2-year basic science curriculum at Mercer University School of Medicine. The BMP program is quite a unique curricular component. Instead of having lectures like most medical schools have, instead we have a case-based presentation model. What do I mean by case-based? When the students walk in the door, their very first day of medical school, they receive a packet of clinical cases, and it is their requirement to learn the basic science information necessary for a preclinical education through the analysis of these cases.
It's very different from traditional medical education, which is a lecture-based curriculum for the most part, like most colleges, which would have, most medical schools have courses, biochemistry, physiology, anatomy. Our curriculum has no courses. We have the Biomedical Problems Program, or as we fondly call it, the BMP. And the way it works is that students are put in small groups, usually 6 or 7 students in a group with a single faculty member who's called the tutor, although that may be a misnomer. We can talk about that a little bit. But and they meet 3 mornings a week, Monday, Wednesday, Friday morning, and study their basic sciences by studying patients with disease, individuals with different diseases, and do the basic sciences in the context of the disease they're studying.
And basically, kind of like it says, problem-based learning. You take a problem and you learn about it. So as you know, we work in different phases, and we get a case every phase. And in that case, you know, we are presented with a lot of different material. So we basically integrate a lot of different disciplines. And when I say disciplines, I'm talking about physiology or pathology or biochemistry, and everything becomes integrated into the curriculum to apply it to that one problem.
Every phase ran about 6 weeks long. We covered a certain organ system, mostly our second year, and some of the more basic sciences our first year. We have 6 to 8 people in a classroom sitting around a large table with a professor at the head of the table. They would give us a packet of about 8 to 12 cases, and we would open it up, read the case, and then sit there and break it down systematically to how we can go about taking away basic sciences and clinical sciences from this case.
And you get handed 2 packets of information. You get handed a packet full of objectives, which is individual objectives and goals for you to learn out of the 6 weeks. And that is set up so you can look at it, what are my anatomy goals, what are my physiology goals, what are my pathology goals, etc., pharmacy goals, and things like that. So you have those goals that are laid out for you. And you also get a packet full of case studies. And the case studies are set up so each case study is an individual patient that you would see at the hospital who would have a disease or a disease process that you would be studying during those 6 weeks. And those case studies are really jumping off points for you to take what you've learned about this particular patient, go home and read and study up and learn about, okay, what's the anatomy like in this patient? What's the pathology like in this patient? What drugs is this patient on? What's the physiologic process going on with this disease? And you incorporate all of those disciplines into that one patient.
When we learn in a way that makes us articulate the problems that we have with the issue, with the learning objectives, talk with one another, I think we learn it in a way that is maybe a little more comprehensive than if we were just memorizing PowerPoints or watching lectures over and over again. I think a lot of us learned in college that when we talked about material that we were struggling with our peers, it solidified it. And so here with the problem-based learning, we do that on a daily basis.
When you join the hospital 3rd year or when you're studying for your board exams, nothing is ever approached to you as a physician from just an anatomy or just a pathology point of view. You have to know how to incorporate anatomy and physiology and the drugs that they're taking and all of the different disciplines into it. And that's where we start from the beginning. So we know from the day 1 of medical school that nothing's ever isolated in medicine, and you have to learn to incorporate everything together. And Mercer does a fabulous job doing that.
Finding out about patients from the perspective of the clinical scenario is exactly how we relate to patients every day at the hospital as third and fourth year medical students and eventually as physicians. But the PBL program in particular takes all of those disciplines together, puts it in a cohesive scenario. They're all very well written, extremely realistic, and puts it all in a format that you're going to see as a physician for the rest of your life. So that is incredibly helpful to learn in that way.
So what you will find in our BMP curriculum is you will find students who are engaged from day one, interacting in a very small group setting with a single faculty member who also is very engaged because they're playing off the enthusiasm that the students are showing towards our curriculum. So all in all, it's a wonderful way to learn the basic science information in a clinically relevant, integrated manner.